Page County Public Forum, a nonpartisan organization, held their first public forum at VFW Post 621 in Luray. The forum was titled Availability and Affordability on Healthcare in Page County, Now and the Future, a Matter of Life and Death. The 2-hour forum featured 3 experts on the subject. Dr. David Coakley, a James Madison University professor.
That leaves about 13 to 14% of the population that doesn't have any insurance, at least that doesn't have any health insurance, okay? And that's a concern. That's a concern for, maybe for you, it's certainly a concern for the people working in healthcare, and it's a concern, I think, for other groups that have to provide services for them.
Dr. David Switzer, a Luray-based physician with Valley Health.
The difficulty with access to care based on finance, no insurance or underinsurance, and that's sort of an across-the-board experience, largely with adults, to a certain extent with pediatric patients, but as he noted, there's sort of a safety net with peds. We have a couple of things that we do to try to mitigate that barrier, but it's still quite a barrier. So the free clinic was mentioned. The free clinic is open 1 day a week for 3 hours at a time. As you might imagine, that's not a very robust primary care resource. It's better than nothing.
And Dr. Jeffrey Fite, a VP at Valley Health in Winchester, Virginia.
An incredibly important federal bill called the Hill-Burton Act. And the Hill-Burton Act was responsible for the building of many of these small rural hospitals and the creation of the Rural Health Network. So Page Memorial and Shenandoah Memorial and Warren Memorial, these were all Hill-Burton hospitals.
Different organizations like Lord Fairfax Health District and Page Alliance for Community Action were set up at the forum. The speakers touched on a number of issues surrounding healthcare in Page County and the United States in general. The ever-hot topic of Medicaid expansion was one of those issues.
The federal government could not force states to do that. Therefore, states could pick. We're going to expand or we're not going to expand Medicaid. If you look around us, West Virginia expanded Medicaid. Maryland expanded Medicaid. District of Columbia has its own system. They expanded Medicaid. Pennsylvania expanded Medicaid. But Virginia and North Carolina did not.
I asked Dr. Fite if there was anything else aside from Medicaid expansion that could realistically be implemented to improve access and affordability to health care in Page County.
You know, Medicaid expansion is really for a very specific part of the population, for people who are, as David said, 138% of the federal poverty guidelines. The challenges of affording health care for the rest are really the challenges of affording a lot of things in America. And in areas like Page County, we struggle to have enough good jobs, where the economy is always really on the edge. You know, it's hard. Healthcare is hard, but a lot of things are hard here.
Dr. Fite also mentioned H-1B visas and how Trump's travel ban could potentially harm the healthcare industry.
There is a supply and demand problem when it comes to practitioners of medical care, particularly in primary care, particularly in rural America. It is increasingly hard to get providers. You know, as a tangent to that, when President Trump first got elected, and there was a lot of talk about the immigration restrictions, where my mind first went was, oh my gosh, there's not going to be any primary care doctors. So many of our primary care doctors are on H-1B visas. I think the statistic is 20% of all primary care visits in America are done by doctors on H-1B visas. That's an absolutely irreplaceable workforce. If those doctors were not able to come to this country on those visa programs, small rural communities would be in a terrible position relative to primary care.
After the doctors finished speaking, they held a Q&A with the 100 people who were in attendance at the event. Dr. Fite said he is proud of the work Valley Health has done in providing medical care to those with limited resources or no insurance.
You know, I feel really lucky to work for a great healthcare system that serves 4 or 5 of these very rural communities, is able to bring healthcare services here and coordinate them with a terrific hospital like Winchester Medical Center, where we provide absolute cutting-edge care less than an hour away. We can fly people to Winchester in 20 minutes and provide life-saving treatments and still provide the primary care and the close-to-home care that we do right here in these small communities. It's really an amazing way to spend your time.
We must note that in attendance at the forum was Sergio Coppola. Coppola is one of 4 people seeking the Democratic nomination to run for the 6th District U.S. congressional seat this fall. Breaking Through will be covering a debate on that race this Saturday, June 2nd from 3 p.m. to 5 p.m. Page County Public Forum will hold their next forum on July 31st at 6:30 p.m. The location of the forum will once again be at VFW Post 621 in Luray. The subject of the next forum will focus on incarceration and reentry into the community and avoiding recidivism. From VFW Post 621 in Luray, Virginia, Theodore Whitelow for Breaking Through.